So I'd like to welcome everyone to the Medical Marijuana Awareness Seminar. Today's topic is cancer and medical marijuana. And I know that that's something that's, let's just say that's serious and near and dear to a lot of people's hearts. These webinars, as you know, are designed to provide information and also to answer questions about the particular topic and also how it relates to medical marijuana. Today we're taking on cancer. And cancer is something that's serious. I know my mother is a cancer. I think I've learned the word thriver, and so it's something that's that hopefully we'll be able to shed some light on what cannabis is, where it can help, and that type of thing. I do want to mention that I have the honor and the honest pleasure of having a co-host today that is someone who has let's just say done battle with cancer and right now is on the side of winning. And her name is Jenifer. I'm going to let her introduce herself. She's with Trulieve. And I'll let her tell a little bit about her background and her story. But towards the middle of the seminar, I'm going to let her talk more about what she went through. I just wanted to do a quick introduction right now. So, Jenifer, will you introduce yourself and tell us about yourself?
Yes, thank you, Mark. So I have been blessed to be working in the legal cannabis industry for the last three years. I work for Trulieve. Trulieve was the first medical marijuana dispensary to break ground in the state of Florida. We are the largest. But this was something that happened along the way of me battling cancer, and we'll get into that later. And that's how I came along with the company. It was because of my own health that I started looking into cannabis as medicine, right? So what I do in my position, I'm a community educator, and I'm constantly visiting and in communication with all of the physicians that are registered to recommend in the state of Florida. I also do community outreach to those that are not. And I put these different physicians together. There are some that can't recommend. So partnering them up together is great because we're able to help, one patient at a time. So basically that's what I do. 90% of my time, just connect with physicians, keep them updated with what the legislature has brought on as the program. Any forms that change, I keep them updated. And of course, any new medication that comes out, I explain it to them, teach them how it works, so they can pass the message along to their patients.
Yeah, but I think the important thing to understand is you did battle with cancer. You used medical cannabis to basically save your life. And by the way, do me a favor, explain the word thriver. You're a cancer thriver. I heard.
Yes, and I learned that from one of the physicians that I met, through my career in cannabis. I'm a thriver because once you go through cancer, there are so many side effects that you stay with and so many things that we struggle with afterwards, that saying that you're a survivor, it's more of a thriver. You're always thriving to feel better and to do better for yourself. And that's why I like to use that word. I don't know, it sounds more positive for me to thrive and always thrive. But yeah, we found stage 3 cervical cancer out of the blue. I was just going to a regular gynecology appointment, my 3-year appointment. And, they found abnormal cells, which were cancerous. And about 2 weeks after, I went through really, really horrific is the word that I can use. I mean, medicine is great, but it was just very tough radiation and chemo.
And it was not a fun time.
At all.
And then I know you're going to tell your story when we get down a little bit farther, but I think the main thing was you got to a point where your doctors basically said there wasn't much they could do for you.
Exactly. I was already doing a clinical trial, and that clinical trial was just too tough for me. There are people that have gone through the clinical trial, no issues, gone through it. I did the first of 5, and it ended me in a wheelchair with 2 blood transfusions. It was very scary. I was not dying on my own. I was kind of like getting killed. That's how it felt. I was deteriorating so fast, and I really didn't want to go that way.
Well, I think also you had 3 children to worry about, not to mention a husband. So it's something where near and dear to your heart. So I'm really happy that you're joining us, because this isn't coming from somebody who's just pitching it on the side. This is coming from someone who's lived through it and really understands it. I think what I'd like to do is mention 2 things to people that are viewing today. At the bottom of your screen, you'll see a little black bar. And on the black bar, you'll see questions and answers like Q&A. And please, if you have any questions, please type them in there. We're going to try to answer every question that comes up. We may or may not answer it during the presentation because we're going to spend, I don't want to make this a presentation. This isn't slideware. What this really is something where we're going to provide some background information, some slides, so we have a basis to work from to answer questions, and it provides you a basis to be able to move forward. So we're going to go through a few of those, but please feel free to type in your questions. There is a chat bar, but we really like to run all the questions through the Q&A if that's at all possible. And please feel free to let us know what you're thinking. We are here to not just provide information about cancer and medical marijuana, but we're here to answer your questions, and that's what this is really all about. So I'm going to, if you don't mind, I'm going to go to a set of slides that we prepared, and I think it's something that we can actually talk from. So I do want to mention that the boundary I want to set for this is we're serious. This is not a game. We're not playing with this particular subject or cannabis. What we want to do is provide some safe, supportive, judgment-free information. I'm not being political. I don't think that's not our objective here. Our objective is to just give you straight information. You know, we're patients, we're students, we're advocates, we're researchers. I'm a practitioner. So we have people that really, we're kind of all coming together, putting our minds together for this particular subject. And cancer is something that's interesting. Jenifer, you want to spend some time on this one, or you want me to take this one?
I'll let you take this one. I'm going to take the other stuff that's coming after.
All right, great.
You're really good.
It's got to point out that when we talk about cancer, we're talking about 100 types of cancer that have been diagnosed and that they've been able to find. There's a number of different variations, and that's why it becomes, when you use the word cancer, it's a group of diseases. And what it's really doing is, as you probably know, if you have it or you have people who do have it around you, it's abnormal cell growth that invades your body. That's what cancer is. Now, there's benign tumors which don't spread, but they still are tumors, and they do have properties in your body that cause problems. All cancer patients, all cancers have the similar characteristics. Your cell is growing and dividing, and what they're doing is it's growing within your body. This continuous growth is contrary to what your body's used to. So it's disrupting the normal cycle of your body, the normal way your body works. It advances what they call death cells. And so these death cells are something that actually deteriorate and take energy out of your body, robbing the good cells from their energy. And it makes something that's that basically they dominate your body. They restrict your blood vessels, and then also they invade your tissue. So you're probably aware of this. I just want to point it out. That's kind of a baseline for us to work from. We're going to be talking mainly about cancer as opposed to benign tumors today. So medical cannabis. This picture is kind of when we went to the practice session, Jenifer. This kind of got your heart, right? Yeah,
that picture. You know, it's not being vain. The whole hair loss issue is just it's like the look of death, you know, and that makes you feel horrible.
But I think it's important to point out that cancer is one of those many conditions that has been studied. You know, it has been studied with respect to cannabis, and it's been seen that it's been one of those things that we see positive results, and we'll talk more about that. In addition to that, there's been studies that medical cannabis also shrinks tumors. And that's something, and slows the growth of cancer, and that's something that's important, because obviously if you have something that's growing in your body that's going to detract from it, it's something that is not helpful. And then also, not only is it physical relief, but I think also there's a lot of people that are battling the mental part of it. I think that's something that the anxiety, the stress, there's a lot of things that go around this that we're taking a look at. I want to point out there's some pioneers in this industry. There's one gentleman whose name's Rick Simpson. He's a father of RSO, and I think you kind of know this. You kind of know this product pretty closely, don't you, Jenifer?
I do. And when we were putting this webinar together, I was actually gonna make sure that we had him on there, and you already had him on there, so that made me really happy. So Rick Simpson, the father of RSO, which is also called full cannabis extract. RSO stands for Rick Simpson oil. Rick Simpson, as you can see here, says he stumbled upon this purely by accident. He was actually using it on himself and a melanoma that he had. So he inquired about it with his doctor, but of course, you know, the doctor refused to consider it. So in 2003, he had 3 suspicious bumps in his skin. and it turned out to be basal cell carcinoma, which is a form of skin cancer. And he made the decision to treat himself with the concentrated cannabis oil. He put bandages over it, and just in a few days, when he took them off, it had completely disappeared, you know, and that's like, wow, really? In a few days? It's just amazing. And he's helped many, many people along the way. You can read more about him, and I definitely recommend you, highly recommend you to please look him up, look up his regimen. You can look him up, Rick Simpson, RSO, or you can look him up at phoenixtears.ca. Great information there.
Yeah, I should point out that Rick did something that I think is really notable. I know that when insulin was invented, they basically, the inventors gave it to the world. They didn't patent it. They basically said, here, anybody who wants to create and produce it, here it is. Rick did the same thing. Rick took his formula and he published it. He lets anybody who wants to be able to really produce a quality version of it do that. And I think Trulieve, for example, you have an RSO oil.
We do. We sell them it looks just like what he's holding. That's Rick Simpson, by the way. That's actually him. It looks like a syringe just like that. It's a plastic syringe with the full spectrum plant material inside. We sell them in a gram. They cost $50. There's bulk pricing. He does speak about a regimen, which is 60 grams in 90 days. And we'll speak a little bit about that further on.
Yeah, but I think the fact that he just didn't hide it, he didn't try to commercialize it. He
awesome.
Gave it to the world. I think that's,
you know, that reminds me of diet fads, that some people find a diet fad that works and they don't want to say it to anybody because they only want to lose weight. He did the total opposite. He found something that worked and he just shared it and spread it, and he's still doing that, and that's just amazing. And that's what we need to do. That's what we're doing here, you know, spreading the knowledge.
Yeah, Rick was in the United States. He then spent a number of years in Canada. We'll talk about that in a little bit. And right now he lives in Ukraine. He's actually working with a lot of doctors in Europe and as well as the Israelis. So I just thought I'd point out he's still very, very active. There's another important player in this formula, and I'm going to let you take this with Jenifer.
Yes, you know, she's one of my favorites. She's one of my favorites. So Cristina Sanchez, look her up as well. I found out about her very recent, maybe in the last 2 years. She is from Madrid Complutense University in Spain. She's a molecular biologist and a biochemist, and she discovered that cannabis does kill cancer cells. She did preclinical, in clinical conditions, and that means in mice, not in humans, okay? But still, she claimed that her best result relied on a complete cannabinoid profile, which RSO is complete, full spectrum, and she called it the entourage effect, right? So we've heard about the entourage effect, and we'll speak about it a little further. And then she said, this is a quote from her, "We have enough preclinical evidence supporting the idea that cannabinoids may have anti-tumoral properties." Okay.
Yeah, I should point out this picture that's here is from a presentation she made in 2018. And it was actually studies that she had done with human studies on ladies that had breast cancer. Okay, so she is very active. I want to point out that 22 years ago, this university came to her and built her a lab specifically to investigate and research cannabis and cancer. Okay, and she's been conducting research for a lot of years. There's over 1,000 research studies that have come out of her, not necessarily from her, but from the work that's been done. She's almost like a lightning rod, especially in Europe, for the study of cancer and cannabis. So there is work being done. I first of all will tell you, we need to do more work. Okay, I think that just because one person has stepped up and one country has stepped up to try to take an active role in this, we need to seriously do more work, because you've got 100 different kinds of cancer out there. There's obviously some work that needs to be done on each one. But I think it's important to understand this is something that's been going on for a while. I love politicians who say, show me the research. And we'll talk about that in a little bit. Here's some examples of it. Now, I think it's important to set some expectations. Right now, there is no research being done in the United States because cannabis, marijuana, is considered a Schedule I drug. They say it has no medicinal value. And that's a whole different subject we can get into. Christina is doing studying in Spain. I know of 7 projects. I work closely with people in Israel, and there are 7 studies that are being done in Israel right now on cannabis and cancer. And there's one that's just come out. There's a company called GW Pharmaceuticals. They have a product called Epidiolex and Sativex. These are synthetics. They say they've reproduced the cannabis. They reproduce cannabis. Well, that's like saying you reproduce an apple. You're good. It's a good thought, but they have produced a synthetic version of cannabis, and they have done research and they have done studies. In fact, the FDA has actually approved both Epidiolex and Sativex here in the United States. So, ironically, they'll approve it in a synthetic version, which is not as effective, but they won't take the real thing. I had to throw that bit out there. So what medical marijuana, what can and has it done? Cancer is a qualifying condition here in Florida for a medical marijuana registry card. That's important to understand. So you can get a Florida medical marijuana card with this particular condition. There are dispensaries that carry RSO oil. Trulieve is one of them. Move, Grow Healthy. They have quality products that are out there. So you don't have to, like Rick Simpson gave the process on how to make it out. You can actually buy it. And I think that's actually a better way to go right now because it's a hard product to make. I should say hard, it just takes a lot of time. But also it's something you can get some quality products. And what I like about Trulieve is you have a bulk pricing program, right?
Yes, we go. Yeah, if you buy 10 syringes, which is 10 grams in total, we discount $100. So each one is $50 times 10 and then minus 100. Yeah. But definitely way, I have to say it 3 times, way more inexpensive than chemotherapy. That's for sure.
That's great. And then also, I think it's important to point out that Rick Simpson, if you look at Rick Simpson and you go to places like the International Patients, there's a thing called the International Patients Patients Testimonials. And I'll get the exact name of it in just a minute, but there are thousands of testimonials about Rick Simpson oil. And doing the research, getting ready for this, there's one site that has 65,000 testimonials about RSO by itself. So even though it hasn't been studied, there's a lot of people that have tried it. This has been around for quite some time. Please go to Phoenix Tears. There's a section called Patients Out of Time. That's something that's important to look at. And then also, again, Christina Sanchez has videos, YouTube videos and things that actually show how cancer has actually shrunk, medical cannabis has actually shrunk the tumors. I think that's important to point out. So there's evidence that there's something there. We need to do more research. There's no question about it. And in the meantime, there's a couple of different options that you can have. You can go the way of the chemos and radiation. And many times I talk to patients whose doctors have said, I can't help you anymore. And that's when they turn to medical cannabis. And it's ironic because they probably should have turned to it before that time. But,
I have to clap that you just said that. Yes, it should not be the last choice. It should not.
But unfortunately, with our system and our culture, that's been happening. But I do want to point out that there are people, and that's why we have Jenifer on today to be able to talk about this. If there's something that's out there, you want to talk about this? There's a few patients that have tried it. There's a website.
So we're going to see now a few patients testimonials, we can call them. This is Kelly Hoff. In the year 2000, they found a 3-centimeter tumor that was discovered in the front lobe. She was only 32. 2003, it was determined as a grade 2, and I am not going to say that word. You guys just read it off of there. And then in 2013, she had a regrowth of the tumor. And of course, chemo is what there is. So that's what she was recommended. Then in 2014, she did a 90-day RSO protocol, and that's what Rick Simpson speaks about, that regimen that he recommends. She used cannabis oil supplements, meditation, yoga, organic juicing, and other natural healing techniques to achieve her incredible results. And it's great that this is here because cannabis is not a cure-all, fix-all by itself. It's not. We have to take care of ourselves. And as you can see, organic juicing has always been extra positive for patients that are going through cancer. Yoga, meditation, because it's not only a physical thing, it's also a mental thing going through cancer. And it's all these things that complement each other on helping the person heal.
Yeah, exactly. I want to mention, you want to talk about Patricia for a second? She was a professor. I'll let you talk about her.
Yeah, so Patricia Crone, in 2011, she was diagnosed with lung cancer and it metastasized to her brain. And the metastasis is something that's very common in cancer patients. It just keeps spreading, and it spreads in different parts of the body, which is crazy. She began the RSO's protocol after she saw the claims that it could kill the cancer, and she began producing it herself. In 2012, the growth and proliferation of tumors decreased. I have chemo brain, my tongue gets stuck sometimes. So it decreased, right? She decided to go under an entire brain radiation for additional, anti-cancer effects. And in 2014, Patricia's tumors were gone. However, her brain was severely damaged by the radiation. For more information, you can see For the Life of Me film.com film to find out a little bit more about Patricia. But Marc, what do you know about Patricia?
Well, I do know that she's somebody who wants people to understand that she waited too long to discover medical cannabis. I think that's the message here. The message was the radiation is it's hurting her now. It's not the cancer. And I think that's one of the reasons why she made the film, was to have people be proactive and not reactive. Don't wait until the doctor says it's too late. It's out there. I think it's important when people say, we talk about efficacy. If you take a look at cannabis in the PubMed, and I don't know how many people know what PubMed is, but PubMed is the library, the National Institute of Health here in the United States has a thing called PubMed. This is where all research is done that's been done for doctors gets put into PubMed. And so it's if your doctor you have a condition and the doctor wants to find out what's the latest research that's been done, or what research has been done in general, they go to PubMed. What's fascinating is I typed in this morning marijuana, and there's 33,530 research articles on cannabis that's out there. Let me give this a bit of a reference, and I didn't put this in a slide. The most researched pharma drug that's out there has less than 1,000 research studies.
Wow.
Okay. I mean, it's absolutely amazing. Adderall, which is what we're giving our children, has only 600 studies. So it's something that over the years, it's been going on. Now, I do have to tell you, you're going to say, wait a minute, if it's a Schedule I drug in the United States, where do those studies come from? Well, candidly, they're all done overseas. In 1964, the United States government started funding medical cannabis research. Let me say that again. Our government, your tax money and my tax money, have been paying for research into medical cannabis, but because it was illegal here in the United States, they went to Israel and they started funding a gentleman named Raphael Mechoulam. And Raphael is a whole discussion in himself. But the interesting part is that part of the research, part of the giving the research money to him, a lot of his studies were put into PubMed, and a lot of the students from the University of Ben Gurion University, University of Jerusalem, and the students and all the people doing the studies all put their studies into PubMed. So I love when I meet with politicians and they say we need more research. I kind of look at them and tell them to look at our own database. It's out there. Now, the pharma companies will tell you that if a study's done in a place like Israel or a place like Spain or a place like England, that it doesn't count. You have to do it again here in the United States. And that's candidly a little bureaucracy to keep progress from being made, and kind of it protects the pharma companies, it protects their cartel. But I do believe that if an apple falls to the ground in Spain or in Israel or in England, the apple will fall to the ground in the United States. And I think that's important to point out. So there is research that's done.
Definitely. And I want to point out, this is a tool, one of the most important tools that I use when I'm teaching physicians and their the healthcare staff members, because that's the first thing they tell me. There's no research. Yeah. And when I pull this up, it's like, whoa, there's a lot. And then they're like, whoa, I'm just, how do I read all this? There's a lot of information out there.
Yeah, and also because the last couple of years there's been a lot of states have gone to legalizing medical cannabis. The National Cancer Institute, which is again part of the NIH, has been looking at studies that have been done, and right now there's 118 studies that are in there. And so you can see that there is research being done. Again, I will say it again, we need to stop this ban on cannabis. We need to get it rescheduled so we can do more studies, because we're battling 100 plus different types of cancer, and we really need to be able to go after it. The enemy is there, we need to go after it. But there are people that are taking the stance, and we are taking the stance and going out and working on it.
Yes.
Now, how does it help you? You're going to say, okay, how does cannabis work? Why does it work for you? And I should point out that in your body, you have something called the endocannabinoid system. And it's very, they discovered the endocannabinoid system, believe it or not, in the 40s, but it really didn't become predominant until MYRCENE did a lot of research and found out that it was tied, and it works very well with cannabis. And that with it works hand in glove with cannabis. You want to spend a moment and talk about this? Or you want me to take this, Jenifer?
I would like for you to take this because I know you're better at this than me.
In your body, every human, in fact, every mammal has what they call CB1 and CB2 receptors. These receptors work in your body. What they do is, it's in this endocannabinoid system. It's the part of your body that helps you regulate your pain, your memory, your appetite, your inflammation, your immune system. They serve as the way your body heals itself. When you have a problem, your body knows there's a problem, and it tries to obviously help itself and try to heal itself. Now, what's interesting is if you take a look at CB1 receptors, most of the CB1 receptors you find are in the brain, are in the nervous, or in the spine and the nervous system. CB2 receptors are mainly found in peripheral organs and in your immune system. And so they're there. And what's interesting is your body will find out that there's a problem. And what it does is your body will then produce what they call endocannabinoids. And there's a whole process to do that. I don't want to get too technical in this presentation, but amandinoids come into play. And what they do is your body will say, I have inflammation, you have a cancer, you have glaucoma, you have something that's there, and it produces endocannabinoids to try to treat itself. Now, you also can add to the body endocannabinoids through what they call, through plants, plant-derived. So this is the buds, the tinctures, the cannabis, the way we know it today. Why would we do that? Well, I'll take myself, I'm a senior citizen. My body doesn't produce endocannabinoids like when I was 20. And so when I have a particular condition where I need help, it helps to be able to give my body a little boost by letting it produce the endocannabinoids that it normally should produce. It now gets the endocannabinoids that are out there. I have one condition I have is I had the ambiance of an automobile accident 4 years ago, and I ended up with 7 herniated discs in my neck and 2 in my back. I wake up in the morning with a level of pain of a 7 or an 8 because of the pain in my neck. And literally within 3 minutes, my leg pain level's down to a 1. And I can work during the day. I'm not stoned, I'm not high. I'm able to manage my pain, and I'm able to work and be a functioning human being, which I think is great. But my body does not produce enough endocannabinoids for me to do that. Now, I should also point out there are synthetic cannabinoids. We mentioned GW Pharmaceuticals. MYRCENE is one, and they use MYRCENE. I think you use MYRCENE in your treatment, right, Jenifer?
I did. It worked, I want to be honest, for the first 2 days. I felt the appetite change and a little bit of smooth stimulation, but it was just the first few days. And it's not something that you take more and more and more, and then that doesn't work that way. It's just not the same. I just ended up going with the raw plant. It worked way better for me.
And also it's THC only, so it has some serious side effects. I mean, it obviously use it with a doctor. It's something to pay attention to. But the point is, this endocannabinoid system is what your body uses to regulate your appetite, your pain, pleasure, sensation, immune system, that type of thing. Let me summarize it for you. Your brain, your nervous system knows there's a problem. It can help get endocannabinoids in your system by using plant material like cannabis. But it doesn't go directly to the CB1 and CB2 receptors. What it does, it goes into your fatty acids in your body. So your fatty acids are like the batteries that your body needs to be able to heal itself. When you have a problem, like for example, I have pain, and some of that pain actually comes from inflammation. So I'm really trying to treat 2 things. What your body does is it goes to those fatty acids, turns them into long chain fatty acids, and that produces the endocannabinoids that go through your bloodstream and addresses that and gets it to that part of the body and provides the healing or the pain relief that's out there. This is important for 2 reasons. Number one, no one has ever died from using cannabis. Nobody's ever died from using medical marijuana. Why is that? Because your body is producing its own medicine. There's no foreign substances. All you're doing is you're providing the material to your body to help itself. That's what's important to understand, that it's your body really healing itself, okay? And the other thing to understand is that if your brain, your nervous system finds there's a problem, you may say, like I might say, well, gee, I'm gonna have a problem with my back and my neck. If you have a problem somewhere else, For example, my mother is taking RSO oil for cancer, for breast cancer. She's now been she's a thriver like Jenifer after 3 years. But what's interesting is about a couple months after starting to take it, she went to the doctor for glaucoma, and the glaucoma was gone. And she asked the doctor, said, "What are you doing?" And she said, "I'm taking medical cannabis." And this is what they call the entourage effect. I think you mentioned it earlier, Jenifer. Your body knows you have a problem, and it produces the medicine it needs to help itself. We've heard of people that take it for arthritis, and they find out that the pain they had in their shoulder for 3 years went away. So this is how it all works. It's a bit of magic. CB1 and cannabis does not go into the CB1 and CB2 receptors. It goes into your fatty acids in your body, produces the medicine that gets it out there. Now, when you talk about cannabis, you're really talking about a couple of major components. Jenifer, why don't you explain them?
So the most popular ones are CBD and THC, cannabidiol, and tetrahydrocannabidiol. So CBD is what we know as non-psychoactive, and it's also found in hemp. And then the THC is the psychoactive component of the cannabis plant. That's where you feel the quote unquote high. Now, when you have a balance or a ratio between the two, you're more willing to feel less of a psychoactive effect when you have a combination of the both.
Sure. Now, when they talk about cannabis, you're talking about, this is what they call the famous CBD wheel. So there are different components of it. There's obviously CBDs, there are THCs. I tend to look at it this way. CBD really is in both hemp and also in cannabis. So hemp oil, so hemp products and marijuana produce CBD. Now the CBD that you see down here, this yellow part, is what's in, is a component that's in hemp and also in marijuana. And so there's 82 healing properties related to that. So hemp oil does have healing properties to it, but when you use a marijuana-based CBD, you also get these components here. There's 108 medical properties to marijuana-based CBD. So when people say, which one should I use? I recommend the marijuana-based ones because this attacks things like, for example, like pain, inflammation, that type of thing. It's not really great for pain, but it does do well. It's really great for inflammation. CBD really does a lot to help with inflammation, and it's something to really pay attention to. Now, the other side of it too is there is THC. And why would you use THC? Because THC does work with CBD. In fact, CBD and THC working together is like 1 and 1 is 3. It becomes much more active. But this is something that helps a lot with pain relief. It helps a lot with, especially a lot of the head injuries. One of the things it does, if you look at Delta-9, it inhibits cancer cell growth. Okay, so the THC part is important. Now, the key to medical cannabis is to have enough THC to provide the medicine that helps your body, but not so much that you can't operate on a daily basis and just be a functioning human being. And that's where people like Trulieve and the other dispensaries have gone out and built products that really help people be able to live their lives, get their lives back, and being able to do that. And when you put both of those together, when you have a whole plant product, the whole plant meaning both CBD and THC together, you get what they call the entourage effect. And the entourage effect means that not only does it address the particular area that you're taking it for, it also helps with other parts of your body that's out there. That's why when some people take cannabis for inflammation or they take it for pain, all of a sudden their attitude is better. The stress level goes down. Their anxiety goes down. It's almost like a whole new world has been opened up to them. Any comments, Jenifer, on that?
Even the skin, even in the skin, you can see a difference. It's amazing.
Yeah.
I prefer the entourage effect. I prefer to use products that have that produce the entourage effect, just because I have so many different things going on with me, you know?
Sure, obviously. And a lot of people don't know. Your body knows where you need help. And what you don't want to do is become a lab rat for doctors. And I'm not against doctors. I'm just saying they have to test. Their idea is until they know what it is, they can't prescribe something. Why don't you let your body help itself? That's all I'm saying. Just let your body take over. Now, there's a difference between hemp and marijuana. Hemp, as you can see, this picture here is a plant it's a stocky plant. It really is good for building materials, biofuels. It has a lot of properties. Florida was actually the #2 producer of hemp, of rope prior to 1938. And what's interesting is when World War II broke out, even though hemp was made illegal, they had special provisions that allowed that rope to be made here for the war effort. and that lasted until 1948. What's interesting is now that hemp's legal, that hemp is making a comeback here in Florida, which is great. Then also you have the you have the marijuana plant, but hemp is kind of a stock, marijuana is kind of a bush. That's why that's why they call it a weed. Okay, it's kind of a bushy thing. So what you're looking for is the little trichomes. That's what really is that's where the magic of marijuana comes into place. So they're brother and sister. In other words, they're not the same plant. It's like they're kind of like the rose family. There's two different types of roses, and they're brother and sister, but they are two different types of roses, and that's what's out there. Now, in the cannabis side, medical cannabis, you have two different types. You have the sativa and the indica. Jenifer, why don't you explain those to us?
So sativa and indica. And at Trulieve, if you guys ever go on a shop page, you'll see that our products are color coordinated, red, green, and yellow, like the traffic light. So sativas being green, like go. Sativas are great for fatigue, for, it's kind of like how coffee makes you feel, but in a good way. It gets people out of their wheelchairs. It gets people going to work, getting up. The plant, it's gonna look tall in stature. It's gonna be a long plant with narrow leaves, longer flowering cycles. That means it's gonna take longer for the plant to bloom, right? And it's suited more for warm climates with long hot seasons, right?
Right.
I like to say in the couch.
Mm-hmm.
Our products that are indica are red, like the traffic light, stop. So indica is shorter. It's short and chubby, and it has broad leaves. It has shorter flowering cycles, meaning we can get more of this medicine going faster. And it's better suited for colder climates with shorter seasons.
Yeah, what's interesting is when I got involved in cannabis about 5 years ago, I was always told about indica and sativa and looking at that. And that's kind of the base level that's out there. But what's happened with research that's been done for the last 5 years by firms like Trulieve, they've produced a number of different strains of different cannabinoids. You hear about these various strains that are out there. It's because what they've done is they've looked at developing a strain that addresses a particular condition. One of the things I love is you have a series of product, Delta 8s and Delta 9s, that are great for pain. And that's for me, managing pain is the number one thing in my life today. I mean, when I can manage my pain, I can lead a normal life.
Everything is much better. Everything is much better once you can manage your pain.
Yeah, exactly. And I think the cannabinoids it's something that's there, but also they've done a lot of research and they found things about terpenes. Why don't you mention about terpenes, Jenifer, for a second?
So terpenes, I like to, when I'm training physicians, the easiest way for them to understand it is comparing it to essential oils. And we'll talk more in depth about different terpenes. But basically terpenes are the smell and flavor that the plant has, right? And there's different types. And for example, linalool, and we'll talk about it a little bit later. Linalool is lavender. That's what's in lavender. And if we are in an enclosed area and we put a vaporizer with lavender oil vaporizing, we will get sedated a bit, yawning and relaxed. And that's because that's what the terpene is making the person feel. And that's the way cannabis works. Cannabis, different strains have different profiles of terpenes, different profiles. Something interesting is that once you learn what profiles work for you, if there is not a specific strain available because it's not rotating at the moment, you can find something similar with a similar profile of terpenes.
Yeah, it's important to understand that when we looked at how cannabis works, in your body you have every person's body is different. This isn't like take 2 aspirin at night and see me and call me in the morning. It's something where cannabis, your body reacts differently because the homeopathic, your body produces the endocannabinoids differently from person to person. And so there's a concept of what they call go low and go slow, meaning that you start with low dosages, you start something like with one-on-one oils and things like that. One of the biggest things that bothers me is that people will start and they'll use it for a week or two. It doesn't work, so they stop. Mm-hmm. Okay, and that's a mistake because when you go low and you go slow, you just may not have your dosing. In other words, dosing means how much do you take, what kind do you take, what strains do you take, and this is where you need to work with your dispensary and talk to them about what you need, and then also your doctor. Your doctor will be able to help you. One of the reasons I work closely with MMTC, Medical Marijuana Treatment Clinics, is because they have a call center. They have a dosing center. If you get your medical marijuana card from them, you can call them at any time. And so what they'll do is they'll help you work on your dosing to be able to address your particular situation. And so what I found interesting, and I'm going to point out, was when I got involved in cannabis, I went into a dispensary. They actually said, you know, here's what I recommend for your situation. The doctor had a recommendation. The person behind the counter said, here's my products that'll work. I took them on faith. I took home, tried starting using them. So about the third time I went back, I decided to ask the magic question: out of the hundreds of products you have in this dispensary, how do you know which ones work for me? And she looked at me, it said it's based on the terpene profile. The terpene profile tells us which products will actually help you with your particular condition. And at that point in time, the light bulb went on that this isn't just something that's random. This is a medicine that's being targeted for the particular conditions that we have out there. Ooh, let me go back in here. This is the conditions that are out there. The various terpenes allow you to be able to dial in the remedies that you need. You might want to mention that, Jenifer.
Definitely. And the guide to the right is really important because, as you can see, there's vaporizing temperatures that differ. So depending on how much you're burning your medicine, you could be just burning off these terpenes. Some of these are very delicate, so you have to make sure that you know what temperatures are proper for your medicine. Terpenes are the most common plant chemicals in nature. They are found in flowers, spices, fruits like mango has MYRCENE, and we'll talk about that later, vegetables, and essential oils like we spoke about the linalool lavender situation. And I really like this part right here. So the endocannabinoid system, and please research it after we're done with this so you can see how real this is the highway. The anandamide, which is what is called the bliss molecule, bliss, we all want to be in bliss, is the driver. Cannabinoid, CBD or THC, is the passenger, and then the terpenes navigate or shape the cannabinoid journey like a GPS. And Mark, I know you can add some more to this, but this is just a great explanation, analogy.
Yeah, everything works in concert. You know, when you get the right strains, which is what the cannabinoids are, your endocannabinoid system knows it needs help, so it actually says, thank you, I've got my batteries are being charged, I now have enough of them. And then the terpenes help you dial in exactly what's out there. I know that in my case, I'm dialing in pain. I did something really crazy about 2 years ago. I had my left knee replaced, and I decided that what I'm going to do is I'm going to put my body where my mouth is, and I decided that I'm not going to use opioids as a post-surgical relief. I'm going to use cannabis. And I dealt with the doctors. I was operated on by a doctor at Jewett Orthopedic, Dr. Richard Constance. And I told him this is what I wanted to do, and he looked at me and said, great, we wanted to try cannabis for post-surgical relief. We had dinner with 5 doctors. We talked about it. We actually worked with MMTC to come up with the formulas that we'd use. I was operated on Monday, and I had to use Percocet on Monday and Tuesday in the hospital. But on Wednesday, I took no Percocets. I wasn't discharged till about 1 o'clock, and I was in pain. I literally went into the parking lot and did some tincture drops, and then I took a hit off of a vape pen. And I have to tell you, by the time we got to the street, you know, out of the parking lot to the street, my pain level is down to a 1. It was the lowest it had been since the surgery, and I've kept it there ever since. That is, and a lot of it had to do with being able to dial in what you call the terpenes. We were dialing in for inflammation, and we were dialing in for pain. And by being able to do that, I was able to manage this. Now I did have to make some adjustments. That's why I used the call center from MMTC. The first week, I think I called them 3 times just to make sure I got my formulas right. We had to dial this thing in because we never used it. This was we were going where no patient had ever gone before. But what was fascinating was there were 5 people I was paired with. 4 of them you were using opioids, and I was using medical cannabis. After a month, 3 of the 4 went to cannabis because they did not have the side effects. Percocet has its own particular side effects. I was in less pain with less side effects than anyone else. The 5th one just disappeared, so I don't know what happened with him. But he was out there. But terpenes are important. I think it's important to understand terpenes help you dial this in. So let's talk about a few of them as that you may want to, when you go into a dispensary and you're getting into cannabis, you may want to look for. So Jenifer, take it away.
Sure. So some of these have tough names, and bear with me. CARYOPHYLLENE. This has a peppery, spicy, woodsy, kind of like clove aroma. Vaporizes at 266 Fahrenheit. And it's great for stress relief. Potential medical value of treating pain, anxiety, depression, ulcers, and then different things that this is found in besides the cannabis plant. It's black pepper, cloves, and cinnamon. So all those products have caryophyllene in them.
Caryophyllene is really important. Limonene is important. This is one of the more popular ones.
Yeah, limonene is very popular, very citrusy in aroma. It has a higher temperature burning point, and it's great to elevate the mood for stress relief, right? This can treat anywhere from anxiety, depression, inflammation, pain, cancer, and like all those things. There's a lot of people have those issues. It's also found in fruit rinds, rosemary, juniper, and citrus fruits.
Yeah, this is a very, very important terpene that you'll find out. It's in a lot of the strains that you'll take a look at. MYRCENE is probably one of the most popular ones.
Mm-hmm. So we were speaking earlier about mangoes and myrcene. So yes, definitely. It has an aroma of cardamom, cloves. It's musky. It's earthy. It's herbal. 332 degrees of boiling point, of burning point, and it's great for relaxing and sedation. The couch lock, the in the couch feeling. Potential medical values are it's an antioxidant. It's great for treatment of insomnia, pain, inflammation, and like we said, we can find it in mangoes, lemongrass, thyme, and hops.
You know, someone asked me when I got involved in medical cannabis about how when they got into medical cannabis, all of a sudden they felt more relaxed. They talked about people just relax. There's a joke in the industry, it's called couch lock. You know, you basically want to sit back and relax. What's interesting is when your body has been in pain, like in my particular case, in pain for quite some time, and all of a sudden the pain goes away, what your body does is your body goes,
yes.
And it just goes, wow. You know, I have to tell you, I literally, and we'll talk about the types of administration. I literally, when I take a hit out of my vape pen in the morning, when I get up, the pain goes away within 2 minutes. And the first time that happens, it's just amazing.
I have laughed. I have laughed at myself because it's unbelievable. My minutes are 7 minutes. I get this really bad abdominal nerve pain, and it takes about 7 minutes. I do 2 inhales really quick, like 3-second 2 inhales. And then I'm like, ha ha ha, it worked again. It always works. It works, you know, and it's like 7 minutes. You know how long a pharmaceutical would have taken and the side effects that it would have given me?
Yeah, it's what I'm trying to point out is that when your body relaxing, your body now realizes that inflammation or that pain isn't there. That's actually a good thing. Being able to relax is not a bad thing for you. You mentioned linalool earlier.
Yes, this is one of my favorites. Fun fact, I actually make spliffs. You know, like you get the joint and you put, instead of tobacco, I put a little lavender in my cannabis. I love it. It's great. So it has a floral aroma. It has a much higher burning point, 380 degrees. And it has, it's good for mood enhancement. So, you know, if you're feeling down, it'll put you in a good mood. And it's great for sedation. You know, a lot of teas have lavender in them, like sleepy time teas and stuff like that. This is great for treatment of anxiety, depression, insomnia, pain, inflammation, and neurodegeneration. Yeah. It's also found, like we said, in lavender.
A lot of people want to say, well, why would you use lavender when you're treating cancer? Look, you had anxiety, you have stress. I don't care what they say. If they tell, I know I don't have cancer, but when they told me my mother did, I had stress. I mean, yeah. and this actually helps with that particular aspect of it because it creates a whole body remedy as opposed to just treating just one thing. Now, what's interesting is I'm a senior citizen, and a lot of the senior citizens are always concerned about, well, gee, am I going to be smoking a joint on the front porch? Is that how I have to take cannabis? And I can tell you we have progressed beyond that, you know, I know we did that when we were younger, but not anymore. I'm speaking as a senior citizen, Jenifer. And so there's a lot of different ways of dosing. We're going to go through that. I want to compliment, if I can compliment Trulieve for a second. I am a huge flamingo fan. And I love your label. That's why I put it on here. I think it's really cute. But there's a lot of different ways that you can use this. Let's talk about how you can, the different forms of administration. It really has to do with what you prefer, your lifestyle, what's convenient for you. Why don't you tell us how we can take it, Jenifer?
Definitely. So let's start, you know, exactly how the chart is. Sublingual drops, aka tinctures. And these take about 15 to 40 minutes for onset, meaning for it to start working for you to feel any type of relief. Now, that will last 4 to 6 hours. Okay, so it says here, taking cannabis in through the mouth, under your tongue. It absorbs via the digestive system or the blood vessels in the mucous membranes of the mouth. These oral products, I suggest, yes, take them, but they're not gonna be the it product for you to treat breakthrough pain or anxiety on the spot. We're gonna move on to the vape pen, inhalation. It's almost immediate. And I know a lot of people are hesitant about inhaling, but it's a fact. You know, you're gonna feel it a lot faster. The onset is gonna be a lot faster. And the effectiveness is not gonna be as long as oral. So what I do personally, my regimen, and we'll talk a little bit about regimens in a little bit, is that I do the inhalation together with the oral. I'll feel relief immediately with the inhalation, and then later on, I'll start feeling the oral. And this is via electronic vaporizing device, and you inhale it through the lungs.
Yeah, there's two things that are important here. I think, first of all, understand that here in Florida, all products are highly regulated, highly certified. I know last year there were some scares about vape pens and products and things like that. I can tell you none of those products, none of those chemicals that were used in that would come anywhere near a product that's here in Florida. You actually have, one of the reasons why you use medical marijuana and you go to a licensed dispensary is you know that it's safe.
Definitely.
And the other thing I want to point out about vape pens is it's really not, you're not burning plant material. What it is more like steam. So it's a lot easier on your lungs. Now it still is inhalation, so I don't want to do that, but it's a lot easier on your lungs. And I know in my case, I take a sublingual drop when I get out of bed, and then I do, like yourself, I do follow it up with a vape pen. I know that it's going to take, in my case, about 20 minutes for the sublingual drops to work, but with a level of pain of 7 or 8, I want to get rid of it like now.
That's right.
And like I mentioned, the first time it happened, I took a hit off a vape pen. It was like somebody took a rag and wiped my back, and when they did that, the pain went away. And I remember saying to my wife, "This is crazy. I mean, this is like, are you kidding me?" And even this morning when I did it, this is 4 years later, I still am absolutely amazed on how the pain goes away. I mean, there is no reason to live in pain anymore. And actually, I've got to a point with my dosing and with been able to dial it in that I'm not high. I am literally in a situation where I can control, and that's important. Now, some people don't like sublinguals. They might want to use capsules, right?
Yeah, the capsules, you know, they also take a bit of time for the onset. It could take anywhere from 30 minutes to an hour. And I highly recommend that if you're not feeling anything within 30 minutes to 2 hours, do not take any more. Don't take any more. Wait till the next day and maybe change the dose a little bit, because, you know, sometimes they can hit you more closer to the 2 hour time. And if you take more, you might have some negative side effects like paranoia, and we don't want that to happen. Once you ingest those, they can take up to 5 to 8 hours, giving you relief. And when taking cannabis in through the mouth, it enters the bloodstream after being digested or broken down in the stomach, and then is absorbed into the digestive system. Edibles.
It's important to point out that why capsules versus sublinguals? Sublingual drops go right into your bloodstream immediately. Yes. The capsules go into your stomach. They're broken down by your stomach, and then it goes into your body. That's why it takes a little bit longer to work, but you also lose about 20 to 25% of the medicine in that process. So you need more medicine when you're taking capsules than when you're taking sublingual drops.
Definitely. Now, the only thing about capsules, like usually patients that have been taking pharmaceuticals are used to taking capsules. So it's a familiar way of taking the medicine.
Cool. Edibles.
So edibles.
In Florida yet, but edibles.
Not yet. We can make our own edibles though. You know, we sell distillates, concentrated form of cannabis that we can make into oils, butters, cook with them. Edibles will also work similar to the tinctures. It'll take 15 to 40 minutes for you to feel any type of effect for the onset, and then last up to four to 6 hours. And edibles it's when we talk about gummies and brownies and cookies and things like that. Definitely, if you're making your own edibles, you can make them as healthy as you want them to be, because you're doing your own recipe. So that's the cool thing about that. Hopefully we'll have
very careful of edibles. I know
Yes.
my mother lives in California, and when we started getting into this, we actually got her some brownies. And I have a good Portuguese Italian mother who has the patience of a gnat. And so we told her a quarter of one of the brownies, and then an hour later, we'll see what's there. After 5 minutes, it didn't work, so she ate half the brownie. It didn't work after 5 minutes later, she ate the whole brownie. An hour later, she called me and said, I'm feeling I feel great, but I don't know what's going on. And I had my brother go look at her, and she came back and said, Mom's baked. Mom's 88 years old, she's baked. The point I'm trying to make is that be careful. It's like the capsules. If you don't feel it after 30 minutes, wait 45 minutes, wait an hour.
Yeah.
It'll take effect. That's just your body. It depends on how your body processes it. And the only thing, in fact, my mom carries edibles with her. That's her preferred form of using cannabis. She carries it in her purse. She carries it all around. But the point is that be very careful with them from the standpoint of be patient. A lot of people aren't patient these days.
And she takes the edibles for her cancer treatment.
Yes. Yeah. She has that's a whole thing I'll get into later.
Yeah, I did too. I did the brownies when I was dealing with cancer. I mean, it was so great to have that little brownie at the end of the night. I know that I shouldn't have been eating such sugary stuff, but it made me feel so good. And I slept like a baby.
That's what she does. Yes, exactly it. Talk about topicals and transdermal paste.
Topicals are probably my most favorite product that's made out of cannabis. It was something that has not been available before this program became legal. It works almost immediately. This is something that you can put on the target area. Topicals would not get you high. You're not going to get high for putting topical in your knees or in your back or anything like that. And the effects can last up from 1 to 2 hours. Topical medicine is applied to the skin directly on top of the place where it's needed. So whatever that targeted area is, you rub it on there. And you can put it on as many times as you want, throughout the day or night.
Yeah, it's great. I use it on my neck quite a bit, like every other day, that type of thing. And in this wonderful world of quarantine, I've been out walking to try to keep my little body in shape, and like all good senior citizens, I overdid it, and so now I kind of pulled a muscle in my leg, and guess what's helping me? My topical.
The topical, yeah. I mean, before COVID, I was working 14 and 18-hour days standing up doing events, community events. And once I got home, I have neuropathy, side effect from chemo radiation. I just put the topical cream on my feet. Next day, first of all, I sleep great because it helps me sleep. I put it on the veiny part of my feet. And then when I wake up the next morning, I can put my feet on the ground with no problem. Amazing.
Yeah, I'm a big fan of transdermal patches. You put on a patch, especially when I was busy, I'm able to put on, like, for example, a THC patch or a CBD patch. And the patches I was using would last 72 hours. Just made it a lot easier to be able to, especially in a busy schedule, to be able to maintain my medicines, maintain my level without having to carry on bottles and worry about things like that.
Definitely. So the transdermal patch, you can feel them within 10 minutes to an hour. I have used them as well. And then they can last up to 72 hours, which is great. You just put it on there and you forget it. A topical medicine is applied to the skin directly on top of near the neck, inside the legs, top of the hands and feet, right here on the veiny parts. I used it. I get TMJ, so my jaw, it hasn't happened in a long time. Thank God. It's one of the most horrific things that I've gotten after this whole cancer thing. And it's that my jaw kind of locks, and it's the most horrific pain. I feel it all the way to my head and my ear, all the way down. And what did I do? I put on a patch, and let me tell you, it worked. It worked. And what I would have been sent if I would have gone to the hospital to the doctor was going to be really tough medicine that I'm so scared of taking now. It's like, no. So, I mean, I'm a huge fan of topicals. Huge.
And sprays were developed really for a lot of epileptic kids. When the kids were having epileptic seizures, that the parents were able to use the sprays to provide immediate relief for them. And it's something that you'll find, and it's a very important product that's out there. Not popular for lots of senior citizens and on a normal basis, but for the epilepsy parts, and for people that need help right away, especially for children, it's really an important part.
Yes, I actually deal with a lot of caregivers and their minor children that have, Dravet syndrome and things like that. And the spray works instantaneously. It can last up to 2 to 4 hours, but when the patient is going through the seizure, they just hold one nostril, do a squirt, hold the other one, do a squirt, and the seizure stops. There's tons and tons of videos on YouTube. You can just look up Canatol RX. If you look up Canatol RX, you'll see a ton of videos of people, actually adults and children, being administered the spray, and you can see how immediately it stops. The seizures stop. So this absorbs via the digestive system or the blood vessels in the mucous membranes in the mouth or in the nose. And if you're doing it through the nose or if you're doing a spray to the mouth.
And then some people, we grew up. I grew up in the San Francisco Bay Area. I lived in Oakland. I grew up in Oakland, which is right next to Berkeley. And flour's been around for a long time. And I guess it's a preferred method by a lot of people. And we now have the ability. We now have access to flour. Why don't you talk about that?
It was not something that was available the first 2 years of the program. And once it became available, we saw a huge increase in patient count in Florida because people, that's what they were waiting for. They wanted the full entourage effect. They wanted the natural plant. And you don't only have to ignite it and smoke it. You can vaporize it, you can cook with it. You can make oils with it. You can make tea with it. So it's not that it's only for smoking, but that's the most familiar way that we've used it in the past. And you can feel the effects almost immediately. It can last up to 1 to 5 hours. And yes, definitely, there is a form that the physicians need to fill out in order for you to get inhalation in flower form. And you can get 2.5 ounces every 35 days and have on you in your possession up to 4 ounces. Now, every 35 days, you will get 2.5 ounces. Okay.
And then shatter and crumble, they're basically concentrated forms of flour.
Yeah, shatter and crumble are both the same type of concentrate. They're just agitated differently when they're being processed and made. And being a concentrate form, you are going to feel the effects immediately. And that's basically also how the medicine works when you're using a vape pen. It's a concentrated form of the cannabis oil. You'll feel it right away, and it'll last up to 1 to 6 hours, and you inhale it through the lungs.
So those are kind of the different dosing forms that are out there. And I do want to point out, like I mentioned in my case, I'm using tincture drops and I use a vape pen. I start that in the morning. I have a regime. I have actually, in the middle of the day, I take a 1-to-1 oil to be able to help me to get through the day. At the end of the day, I typically have either a 4-to-1 or a 9-to-1 product that I use. And candidly, I have my evening regime to be able to just relax and be able to sleep, and it makes a big difference. So there's in other words, there's multiple forms that you can use in your regime to be able to help you. You're not stuck with just one. It's not a one-trick pony. Okay. Now, let's talk about the full extract cannabis oil.
So full extract cannabis oil is RSO, Rick Simpson oil, and that's what we called it at Trulieve, full extract cannabis oil. Different things that I wanted to talk to you guys about that are important is having a regime, just like you were saying. Having a regimen, a regimen is a prescribed course of medical treatment, way of life, or a diet for the promotion of restoration of health, meaning you do these 2 products in the morning, this one product in the afternoon, and this other one at night, right? That's your regimen. Now, micro dosing, start low, go slow is our motto. Even if you're cannabis savvy and you've used cannabis all your life, especially with oral products, microdose. And microdosing usually refers to the practice of taking tiny portions of the medicine or substance. And it's important to use it just that way in tiny little pieces. A microdose is typically 1/10 or maybe 1/20th of the full dose that you've been recommended. Titration. And this is a word that we use a lot when I speak to physicians about patients that are using pharmaceuticals and want to wean off of some of them or all of them. They should not stop cold turkey on the prescription. So they should titrate down on their medications and then start slowly microdosing, titrating up on the cannabis. So it's a way to limit potential side effects by taking time to see how your body is going to react to the drug. Journaling. Journaling is so important, and I'm terrible at that. I'm so terrible at it. Keeping a written record of your cannabis dosage. How much did you take? How many times a day did you take it? Basically, you can do like a little note. It doesn't have to be a huge journal, 2 pages of what happened to you. I mean, you definitely could, but you don't have to. Just those little simple information tips, so you know what you've been using and what's working for you. The time of dosage, the amount of dosage. Did you take it in an empty stomach? Are you taking any other medicines with it? What effects did you feel in your symptoms? How long did it take for you to feel it? And then overall change compared with the last dosage. Okay, so this is all really important stuff. I think this is the most important thing in your cannabis journey. And we've spoken about this more. Cannabis is very personal. We're all different, and we all have our own different regimens and what works for us.
Yeah, I didn't realize how important journaling was, and you're right. I'm terrible at it as well.
There's even apps now. There's some apps that you can do your journaling, your cannabis journaling in apps. So.
Yeah. But when I had my knee operation, my left knee operation, I was actually trying to battle 2 things. One is I was battling the pain. I was also battling inflammation. Because if you get the inflammation down, then obviously the pain. And so I actually had 2 regimes, one for pain, one for I used a lot of CBD oil for the inflammation. But in working with my doctor and in working with the doctors at Jewett as well as at MMTC and of course a couple of different dispensaries, the journaling was very, very invaluable to figure out what worked and what didn't work, to help me dial it in. It was important to dial it in. I needed to get my pain level down and my inflammation down. And I probably saved myself 2 or 3 weeks of experimenting by doing the journaling. I'll throw that in there. I still am bad at journaling though. Tell me about Trulieve a little bit.
So that's what Trulieve looks like. Actually, you're at one of our stores right now. That's your background. We have 51 locations as of today. Very clean and welcoming locations. It works just like a regular pharmacy. You know, you walk into the front desk, you speak to the front desk person, and you give them your information. They make sure that you are registered with the state, you're all good to go. And once it's your turn, you get called into what you're seeing here, this picture where everybody's standing at, which is the sales floor. In the sales floor, you're gonna be dealing with your own patient consultant that you're gonna be asked, what kind of relief are you looking for? They're not gonna ask you what condition you have, but they're gonna ask you what kind of relief you're looking for. And the second question they will be asking you probably is, are you naive to cannabis or you've used cannabis before? And then they can start leading you to those products that will be best for you, right? We are open every single day. We deliver every single day. Delivery is free for anyone 65 and over. We have over 250 different products to offer. And you're welcome to go.
It's very much like your pharmacy. These folks are really dialed into cannabis and they can really help you. And I think it's important to understand that Trulieve does a lot of work in training their people as to what products you should use and that type of thing. It's like I jokingly tell people, and many people don't know, it's like an Apple store with a waiting room.
Yes.
It's very clean, it's very nice, it's very upscale. I know when I first got into it, my wife expected some sort of a pot shop, head shop. It's about as far cry from it as it possibly is. It's more like Macy's. Let's put it that way. I think that's important. Tell me a little bit about your products.
So True Nanotechnology, and this is something we brought out, I want to say about a year ago, we started bringing out some of the products, and in the images, you can see the different products that we have. This is made with our nano emulsion technology, achieved through a process of sonification. Now, what happens is that the molecules are broken down in smaller particles, so you have a quicker onset. You're gonna feel it faster. The tincture that you see there, you're gonna feel that specific tincture faster than a standard cannabis oil tincture. The bioavailability of the product is over 90%. So you're gonna save money. You're gonna feel it faster. You're gonna, take in a lot more of the product. And it's water soluble. And that is like, wow, cannabis oil or cannabis water soluble. That's amazing. We have them in different ratios, 1:8 being CBD to THC, or 8:1 THC to CBD. And these are $55. The bottom right picture, there's a white powder spilling out. That's called True Powder. And it brings a scoop which a full scoop is 5 milligrams. In the container, there's a total of 200 milligrams. It's $50. This is a powder that is also water soluble. Best to be used with warm liquids. No one's gonna know this is cannabis. And of course, nanotechnology, you're gonna feel it right away. This is a great way to microdose throughout the day. You can put it in your tea, your coffee, your smoothie. Water soluble, I mean, this is great technology.
I use True Powder. Sometimes when I make smoothies, I use True Powder for that. What happens is it just, instead of using the drops, I'm able to do this. It's important to point out this nanotechnology. This is kind of new. This is new to the whole cannabis world. And what it did was, if you took a cannabis product maybe 4 years ago or 3 years ago, and you put it on top in some coffee, you kind of like how you'd see a film at the top of the. Have to stir the hell out of it to be able to get it.
And you're probably gonna lose most of it. Yeah.
Yeah. Now what you're able to do is have it go right into that particular liquid, that particular beverage, and you don't lose it. And you don't lose it. It's a huge breakthrough.
It is. It is. I also want to bring up the True Tincture drops, and they look like lozenges, but per the state, we have to be specific about what we name our products, and we couldn't name them lozenges because lozenges are too close to edibles. So True Tincture drops. They're each 10 milligrams. There's 10 in the entire container. Is $20. And these are in THC, full THC. We have them in CBD, and we have them in a ratio of 1 part CBD, 1 part THC. Basically, you pop the lozenge in your mouth, swirl around, leave it like under your tongue, and you'll feel the effects of it within probably 10, 15 minutes because of the nano emulsion.
I should point out.
No one will know it's cannabis.
Yeah.
It has a mint flavor.
Yeah. I should point out, when you see 1 to 8, 8 to 1, what they're talking about is the ratio of CBD to THC that's in that particular product. So for example, in the morning when I start out, I have a product that's 12 CBD, 1 THC. I take that. That is to go after the inflammation that's in my body. I still have inflammation. Look, I'm an old dog. You know, we all have inflammation at my age. And so it helps me go after the inflammation. What does 8 to 1 mean? 8 means there's 8 THC to 1 CBD. That's a high ratio, 8 to 1. I start in the morning with a 4 to 1. And the reason for that is I'm going after pain at that particular point. So I have something that helps my inflammation and something that helps my pain. And I found a combination of products that work well together. When you talk to your doctor, when you talk to your dispensary, this is how they figure out, when you say go low and go slow, these are some of the ratios that you're looking at. It's the amount of CBD and THC that's in the product, and then of course the amount that you take, whether it's 25 milliliters, 50 milliliters, how much in the dropper is it, the first line, second line, third line type of thing. So there's different ways of being able to dial in the dosing that you need to be able to help you out. And by the way, I'm a big fan of the nanotechnologies. Delta 8, one of my favorites.
I like that a lot. I do too. I have it right here. Oh, I can't open it. Right here. Yes. This, I can say, makes you feel quote unquote normal. That's my opinion. I can say quote unquote normal. And for us that we've been through so much, especially with pain, to feel normal is really tough.
Yeah, this is when I got, and I have to show you, this is one of my buddies. This is a TruePod, and I'm not really trying to push products or anything like that. I'm trying to give an objective opinion, but in my opinion, this product is better than Percocet. This is the product I used when I got out of the hospital. I literally 1 or 2 hits of this product and my pain goes away. And I mean, it goes away. It works every time. I was absolutely amazed. And it doesn't mean that other products don't work. I'm not saying that, but I'm just saying this is the one, at least for me, that's really giving me the roof. Now, the one I use is the one that's 1 to 1 to 1. Okay.
Me too.
So CBD, Delta 8 and Delta 9. But I found it to be, I'm just really impressed with what's here. And it's very easy to use and very easy to carry around. I carry it during the day because with my knee injury, my knee problem, I may step off a curb wrong. I may do something crazy. I have 2 grandkids who love to come over, and picking them up, running around with 2-year-olds is like a gym. It's like a gym exercise. So it really helps me be able to, after when they leave, it helps me be able to get my body back. Let's put it that way. But
yeah, this product is great for appetite, since we're speaking about cancer this evening. And I know we all struggle with appetite. This product is great for appetite. Now, another great thing about this product is that you're not gonna feel super high. It doesn't make you feel that highness. It's so much more balanced. The 1 to 1 to 1, for example, Delta 8 and CBD are not psychotropic. It's the delta-9 THC that's psychotropic. So there's 2 portions of non-psychotropic components and 1 is. So it's very balanced. You can function perfectly fine. I mean, I know it's your favorite product, one of my favorite products too, because we have a lot of work that we do. We have to be on point all the time. We can't be drowsy. We can't be sleepy. We have to be functional, but also we have to control our pain. So this is an amazing product, and we are expanding more on this line.
I work with 5 websites and 6 social media networks. I can't be high. Well, I guess I could be, but
you look very happy and you look great, so it's working for you.
But I have to be able to be on point every day to be able to help answer questions, to be able to manage those. So I love this product line. Let's talk about overall. You mentioned something earlier about your overall balanced living to help you out in your particular case.
In my specific case, you know, my doctor, my oncologist was like, this is not the time to diet. You need to eat whatever you feel like eating. But me, I was like, no, I have to eat healthy stuff. And, you know, I did. I was doing a lot of course, chemotherapy was the first thing I did, you know. I didn't have time to think. My kids were young, and that was what was made available for me from the medical side. So I ran and I did immediately the chemotherapy and radiation, but I was doing herbal teas. I did fast, even though, you know, he's like, eat. I did fast. I did a lot of walking in nature. Even if I was going 0 miles an hour like a turtle, because I was, you know, very fatigued and tired. I went outside, I smelled fresh air, I got sun. I had a therapist, you know, that I spoke with. I also had religious assistance, you know, from my church. And I did a lot of juicing. I actually, my mom helped me with the juicing because I was sometimes 2 weeks, we didn't make it for myself. A lot of juicing, and eating just healthy foods, you know, try not to eat processed things, try not to eat sugar, very important. And I think all of that in a combination with cannabis, especially when I finished doing my chemo and radiation, and then I did that clinical trial that I couldn't finish, I was so deteriorated and weak. And that lifestyle boosted me up that I looked younger. I had so much more energy. I was slim because when they were giving me all the chemo, they were giving me 6 hours of chemo once a week. And in that 6 hours, they were injecting me with steroids, which had me super blown up. I didn't even look like myself. If I show you a picture of what I look like, you don't even recognize me. So, you know, nutrition, diet, meditation, talk therapy, and basic self-care. Love yourself. Take care of yourself. Try to be in tune with what your body is telling you.
Yeah, it's important. I think, look, we've learned with this COVID-19 thing that the only thing we really have in life is our body, our life. I mean, that's the most important thing. The cars, the houses, all the rest of it, that's nice. But you've got one thing, and that's your life. And the question is, how much do you value it? And I know that when I was an athlete for a lot of years. I was a golfer. I spent 40 years playing competitive golf, and I did worry about my body. I did worry about eating. I did worry about my diet, but you know, it's something that this is the only engine that you have to be able to go forward. And I really don't like people, whether it's churches, politicians, friends, or whatever, telling me how to run my life. I've got one life, and I'm going to live it where I can have the best possible, give myself the best possible chance of enjoying it as long as I possibly can. With chemo, for example, in medical cannabis, it helps with the nausea, it helps with the vomiting, it just helps with your appetite. And I think that's important. It helps you get through that very, very trying period. And I know that one of the things and I'll talk about golf, is you have to mentally be prepared to play. When you want to play, I played professionally, and the difference between an amateur and a professional is the mental training, that you really are there. What I learned as I got older in life is I took that mental training that I used to be able to make myself a better athlete, and I actually, in the mornings, I actually do a meditation routine. I do a routine with Tai Chi that's exercise and meditation, and I do it every day, and it really helps my body. It helps me put myself in the place I need to be able to go forward. And I think that's a whole lifestyle. I think you got to really take a look at, are you going to basically take care of yourself? I think that's something we'll point out. It's there. Cannabis, marijuana is not, it's not a magic wand. It may be fairy dust, you know, it does help you there, but it's not like you need one thing. You need to kind of take a look at the whole thing that's out there. So I'm gonna stop the slideware, and why don't we go to answering some questions? How's that sound, Jenifer?
Awesome. Yeah, let's do it.
You want to grab any of them?
All right, let's see. I'll go.
Nick says it's medically accurate to say cannabinoids, including CABD and CHD, stop the progression and spread of some cancers. You want to take that one?
Well, I mean, we spoke about Christina Sanchez, and you saw the research that she's made with the mice, and the tumors went away. They disappeared. So, I mean, if it works on mice, usually all the medication is tested on mice before it's tested on us.
Well, it's not only just mice, but she also showed that it worked
The
with
breast cancer.
Yeah.
Mm-hmm.
And so a lot of ladies won't want to be referred to as mice. Let's put it that way. No, but I think it's something that, it's something that that I think is important. Look, she has shown that this works. Okay, there's videos on YouTube that's out there. It hasn't been. It's something that she's received a lot of flack for, because you can imagine that a lot of pharma companies and a lot of people don't necessarily want to give credit to her. But it's something that we do need to do more research. We do need to do more work and really understand it. But it's something that I would say it also depends on your body. It depends on your condition, and it depends on your stages. I've worked with people that are in stage 4. I've worked with people that have been given a week to live, and they're still here. One of my neighbors, about 3 years ago, one of my neighbors came over to me and said one of our neighbors down the block was brought home. This was on a Tuesday. He was supposed to be dead by Friday. He wanted to die at home, and he came over and said, "Can you help him?" And I said, "Look, I ain't got no magic wands here. There's nothing." So I went and visited him. Then it was Ralph. I went and talked to Ralph, and we got him a card. We got him medical cannabis that literally that day, because he didn't have a lot of time to worry. What was interesting is that day I talked to him. He was about 400 pounds. Seriously, he looked like Jabba the Hutt. He was sitting in a chair. His wife was about 100 pounds. And we got him some medical cannabis. And the next day, to get him a cannabis in a day, candidly, I did it a little illegally, okay? And the next day, his wife called me. She said, "Come over. It's like 8 o'clock in the morning." And my wife said, "He's dead. They're going to arrest you." I said, "I don't know about that." So I went in and I talked, and he knocked on the door, and he came in and he said, he said, "Listen, I don't know what you told me yesterday. I don't remember half of it. I take 29 drugs." He goes, all I know is that what you gave me yesterday, for the first time in 3 months, I have control of my plumbing.
Wow.
And he said, "I don't know what it is. I don't know what you told me, but how do I get more of it?" And let's go through this again so I can pay attention. Next morning, I get a call. He wants to see me again. And my wife says, "For sure he's dead. Their wife is going to beat you up." I went over to see him and knocked on the door. And guess who answered the door?
He did.
The day before, he hadn't walked in like 6 weeks, and he actually tried to stand up and go to the counter. Now, obviously, his legs weren't there. His wife was there with a wheelchair. His wife wheeled him to the front door. He literally kind of stood up with her. He opened the door, and I said, "Ralph, what the hell are you doing, man? You can't walk." He said, "I know, but I wanted to let you know I feel so much better."
And he was sent home to die.
Yeah, he was sent home to die. Well, he didn't die. About literally about 3 months later, I was moving to another location, and I'm in Home Depot, and I get a tap on my back, and guess who it is? It's Ralph. He says, "I got to buy you lunch." I said, "What do you mean?" He said, "Look," he said, "remember me? I'm the dead guy." He said, "I'm the guy who died 3 months ago." And he said, I had lunch with my wife today." He goes, "You don't understand how important that was." He said, "I own a sailboat, and I thought I'd never sail again." And he said, "Last weekend, I can't sail it. My kids took me out, but I was able to get on and off the boat. I was able to go downstairs and get a beer and come back, and I was able to enjoy my boat. And I want to thank you for getting my life back."
That's a beautiful.
And I have to tell you, it's stories like that that really get me motivated to stay in this industry. Now, in his case, it worked. I'm sure there's cases that doesn't. But I do think, let's put it this way, why wait? You have
It's
nothing.
worth giving it a try. Remember, cannabis hasn't killed a person yet.
Yeah,
It's worth giving it a try.
Okay, so one of the other questions was Rita. Do you see Rita's question? It says, "I finished chemo, and after I have, I don't know how to pronounce this. I'm going to do a terrible job.
Lumpectomy, yeah.
Why don't you answer it? Why don't you take this
So
one?
she says, I've just finished chemo and after I have a lumpectomy, I will be receiving a preventive infusion. Will cannabis that you are speaking of interfere with my preventive infusions or make the infusion completely ineffective? You should always speak to your doctor, especially your cannabis doctor, and they should all know what you're doing. I'm not a doctor, so I don't like to speak about things like that. But in my personal case, I did the same, and there was no interaction that we were aware of. Mark, I don't know if you want to
Yeah,
chime
no, I
in.
think we're not trying to hand out medical advice in this. That's not our objective.
Okay.
Go talk to your doctor. But there are cases where cannabis has helped with this particular situation, and if you have it, take a look at it as an option. You have options. You have hope. So why don't you take a look? That's an avenue that you can go down. That's the best recommendation that I would make. One of the other questions that came up is, it says, how do I find tincture profiles for a specific strain?
So that you can find in the lab reports. So at Trulieve, when you purchase medication, by the way, I want to mention that Trulieve has the only exchange policy in the state. It takes a time to find your sweet spot, what I call it. When you find a product does not work for you, you don't feel anything, or it makes you feel bad, please exchange it. Do not keep it. Do not keep taking it. You don't have to. So all of our products have a batch number on the vials or the containers. Those numbers, you can plug them into our website, trulieve.com, all the way at the bottom, and it'll show you the lab report. This lab report will give you a breakdown of the terpene profile. So let's say you buy a sour diesel and it makes you very uplifted and very functional, and you want to take something similar to that, but there's none of that rotating right now in the harvest. Then you have that lab report where you can see what the terpene profile is, so you can purchase something similar.
Yeah, I think there's three things. You can ask the person when you go to buy it. You can ask the person behind the counter, and they'll tell you. I think the second is, if you take the product itself on the side, they'll have a QR code. So if you take your smartphone and you just put your camera up to it, it'll actually pop up that lab report that's there. Now you're reading it on a cell phone, so that's a little tough for those of us that are senior citizens. That's a little tougher to see, but it's definitely there. And I think the third way is, like you mentioned, take those numbers, put them in the website, and you'll be able to see it's there. But it's very easy to find that out, that be able to help with that particular question. Jeff asked a question, and I don't know how to answer this. Maybe you can help. It says, I have a very rare type of sarcoma, and I have no other treatment options. Would medical marijuana work? And I am currently using RSO. Do you have any comments on that, Jenifer?
Well, RSO is medical marijuana. Okay, so I have a very rare sarcoma. I have no other treatment options. Yeah, I mean, RSO would be it. Like I said, we all have our own regimens. You can use other cannabis products as well, but I believe the RSO has shown to work best because of the concentration and the full spectrum of the plant being in there. So I think you're on the right course. Just, I would suggest looking into Rick Simpson's protocol that he speaks about, how much to take, how much titration, microdosing up to a certain amount. I believe it's a 90-day protocol.
Yeah, I think the best way to answer that, Jeff, is go talk to a medical marijuana doctor. I know that almost all the medical marijuana doctors, if you don't qualify, you don't pay for that visit. So you go chat with them. I know in the case of MMTC, go talk to the doctors. They'll answer that question for you directly, which I think is what you need. I mean, you're talking about your life, so let's get you the right information.
Yes.
And then what's interesting is the doctor will be able to not only address that particular issue, but more importantly, they'll give you the recommendation that you need, that the dispensaries can use to be able to provide you the products that will be able to help you. So there is a path that you can follow, and I just recommend, I would like to loop a doctor in on this, because I do think it's important to really answer this, because I think it's important to you and it's important to your life. It's there. So there's one question that says, what is the RSO oil at Trulieve called? Is it under topicals?
So it's called full cannabis extract oil, and it's under, if you go on the shop link, it's going to be under syringes.
Okay. So you don't necessarily use the word RSO per se.
No, I mean, we use it casually, we do use it, but it's labeled as full cannabis extract oil.
Yeah. So one of the questions that Gina asked the question, she says, I've attended a few of these webinars, forgot to ask the question, if you're a medical cannabis patient, can you donate blood?
Ooh, I don't know that one. I don't donate blood because of my cancer condition.
Yeah, I don't know how to answer that question. I don't think I don't think it's a matter of medical cannabis per se. I think it's a matter of what condition that you had. I think that has something more to do with it than anything else. I can't answer that question, but I'll tell you what I will do.
I know the blood gets filtered, you know, when they collect it to use in other patients.
But I don't want, I'll tell you what I'm going to do, Gina. We're going to flag that question.
Yes.
I'm going to go ask a doctor and I will get back to you. I think it's the best way to handle it. Okay. I think that's an excellent question, by the way. Thank you very much for bringing that up. It says, now, Peter brought up a question. It says, do you recommend RSO for cancer prevention? And if so, what dosage?
Definitely. And I continue to use RSO in micro doses. I use very little every single day, tiny little bit. I use about half a grain of rice. I don't feel much of a psychotropic effect with that amount. Definitely. I definitely recommend cannabis for prevention.
Listen, my mother was diagnosed with cancer 3.5 years ago. She was 88 years old. Okay. She called me up and look, I come from a Portuguese Italian family that's very conservative. I didn't use cannabis when I was a kid, candidly, because I was a competitive athlete and I didn't do a lot of drinking either. I mean, when you play golf, it's like it's you and you. And candidly, one stroke can mean a lot of money to you. And so I was very conservative on that particular spot. When I got into medical cannabis, my mother was like, I'd gone to the dark side. You know, it's like Darth Vader had arrived. And when she called me up and she mentioned that she had breast cancer, I said, Mom, and the doctor wanted to do, at 88, wanted to do a mastectomy. And I said, Mom, we're not doing any mastectomy. At 88, if the chemo and radiation don't get you, the mastectomy might. So we put her on RSO oil right then. And she's alive today. In fact, I have plans to go back in August. Her birthday and my birthday are one day apart. And we're gonna try to celebrate our birthdays together. Although I think the COVID-19 virus is going to step in and kind of prevent us from doing that. But the point I'm making is she's alive. She's like the freaking Energizer Bunny right now.
That is so awesome.
And she's had a whole change of life. I think it's very important to understand now. She's gone into what you call a thriver. She's gone into a remission state. But I make sure every night at 10 o'clock, she takes her RSO oil. Not only does it help prevent, but it also helps her sleep. I think that's an important part that's there. And like I say, she's, for her age, I'm amazed. Like I say, she drives me nuts. But, welcome to Portuguese Italian mothers. So one of the other questions, so that answers the prevention issue. Let's see, let me go back here. So Elaine had mentioned, I have some CBD lotion. Would it be okay for me to mix drops of oil with THC in the lotion before I use it?
Definitely. We actually sell TruClear, which is a concentrated form of cannabis oil, where we've seen patients purchase our lotion and then add additional drops of that oil. Just make sure that you mix it in well so it goes evenly in your lotion, but definitely that's something you can do.
Well, I think also one of the things to point out is that you talked about your nanotechnology. One of the things about the lotions is with the nanotechnologies, they actually get into your bloodstream much quicker. In fact, a lot of lotions that you put on don't get into the bloodstream. Okay, and that's important. So it depends on the type of lotion that you're using as well. I'd recommend going with one of the new nano CBDs because that'll get into your bloodstream. Yes. And if you're buying one of those, you can probably get some with THC in it as well, rather than doing your own mixing. If you want to do your own mixing, that's great, but make sure that the lotion does get into your bloodstream because that's going to be key to being able to help you out with your particular problem. She also asked an interesting question. I don't understand the difference between Delta 8 and Delta 9.
Okay, so Delta 8 and they're both THC. THC Delta 8 and Delta 9. They're both THC. It's just the Delta 8 is not psychotropic like the Delta 9. Okay, so it's THC broken down into two parts. The Delta 8 not psychotropic, Delta 9 psychotropic. So if you take straight Delta 8, it's similar to CBD, but it has all the good benefits from the THC.
and mean it doesn't get you high.
Exactly.
Psychotropic is getting you
Super
high.
functional, but you get all the benefits from the THC.
Right. Now, why you use the Delta 9 is because it has a little more pain relief, let's just say, factors to it than Delta 8.
Yes, it's
And that's
a
why they mix
well
Delta 8 and
balanced
Delta 9
product. That product doesn't only come in a TruePod cartridge, but it also comes in a TrueClear syringe and a glass syringe, where you can also ingest it orally as well.
It's out there. It says, does Trulieve have a transdermal patch?
Not yet, and we are working on that. So hopefully soon. I don't have a date on it yet, but we're working on it.
Yeah, I'm a big fan of patches, and I'm looking forward to seeing your patch.
Definitely.
So I think we ran through all the questions. I don't know if anybody has any other questions that are out there. So, do you want to say something to wrap up, Jenifer?
Well, I want to thank you for having me. This is a great pleasure to be in this platform and be able to educate and, you know, just be here and share my story and what I'm doing. I know that it's difficult for a lot of people to take away the stigma of what we've been taught all of our lives. But, you know, this is a plant that's been put on this earth for our benefit. It has not killed anyone yet. And I encourage you guys to please research the endocannabinoid system, research terpenes, and then go on PubMed.hub and do your own searching. And like that, please also share with others, share the knowledge.
Yeah, and there's a lot of things that are out there. As I mentioned, it's an important subject. I mean, it's called You Bet Your Life. And when it comes down to Your Bet Your Life, I spend a lot of time researching and looking at this. I know I'm an engineer by trade. I'm a computer scientist. And when I got involved in this industry, like all engineers, I had to know exactly what went on before I would work in it, recommend it, or do anything. And I suggest everybody does really the same. I want to thank everybody for coming, or for being here. You will receive an email follow-up, and you'll be able to go to a web page that will have this video. It'll be we're putting it on YouTube. It'll also be on that web page. We have a lot of things that follow up. So there's going to be a lot of articles, a lot of information that's out there, information on Trulieve. So we have a follow-up email that's coming there. And if you have any questions, just let us know. You know, you can send it to event@marijuanaaware.com, and we'll be able to answer your questions. So it's something that we do reach out. We do really pay attention to this. And I want to thank you all for coming, and I want to thank you all for your time. Thank you.
Thank you, everyone. Be well.
Bye now.